Hello, everyone. I'm Dr. Rohan Khandelwal, and it's an absolute pleasure introducing Dr. Vishal to all of you. Dr. Vishal has secured rank 2 in the recently concluded NEET SS exam. Heartiest congratulations, Dr. Vishal.
Thank you so much, sir.
So, Dr. Vishal, why don't you tell us about your journey with Maro? When did you start using Maro Super Speciality app for your surgery preparation? And please tell us about where you did your undergraduate and post graduation as well.
Yes, sir. So, hello, everyone. I'm Dr. Vishal Hubballi. I finished my undergraduate from Bangalore Medical College, and I did my post-graduation from Mysore Medical College in Karnataka. And this was my second attempt in NEET SS. So, my journey with Maro started approximately 1 year ago when I started using Maro for my INI SS preparations. So, from February, March of 2024 till the recently concluded NEET SS exam, I was using Marrow.
Perfect.
So that's yes.
So, Dr. Vishal, you said that you were interested in surgical gastroenterology when we were talking before, and that's where you were preparing for INISS. But unfortunately, you couldn't get through to the interview. So,
Yes.
what made you change the track to NEET SS, and how different is the preparation for both of them?
Yes, sir. Obviously, NEET SS and INSS they have a very different approach to the papers. Right?
Right.
Like for NEET SS, it is okay if we know the basics of each and every subject instead of knowing the in-depth knowledge of all the specialties which are there. But for INI, obviously, we will have to study in depth of each and every subject. Plus, there are 25 to 30 general surgery questions also. So, uh, using Maro for INISS level, it was a very handy and helpful source we had, sir.
Hmm.
Because Maro gives the most comprehensive and more detailed uh, information about a particular specialty as well as the general surgery part of it, sir. So, for example, your videos of general surgery very helpful. So, what you teach there is very crisp, concise, and exactly what is needed for the exam. We don't have to break our heads, to read anything more than that. To be honest, and
Right.
even the surgical gastro videos and notes were very helpful, sir. Like they covered each and every topic, even from the specialty books like Shackelford, Bloomgart, and even the questions were to the standard of INISS in Marrow. So, I think for INSS, Marrow is a sure shot best source which is available. And even coming to NEET SS preparation, sir, it is slightly different because, like I said, the basics of each and every specialty is enough. And again, if we go through the, like you mentioned, sir, the top five topics from each specialty, if we go through that from the Marrow SS videos and the Q bank, I think that is more than sufficient for NEET SS exams.
Yeah, so I also feel so, and that's why I got a list made that you do the general surgery videos, plus you do the top 5 topics which are frequently asked from all the subspecialty videos, right?
Yes.
And they've also covered them in their revision videos, and that would give you a slightly in-depth view, which an MS candidate should know for the NEET SS exam. Also, I feel that the tables, so I made separate videos for Sebastian tables, and sometimes questions come from those videos as well. So, a combination of this general surgery, top 5 topics from each subspecialty, and Sebastian table videos is good enough theoretical preparation for the exam. And then, of course, you need to supplement it with the Q bank.
Yes, sir.
So, Dr. Vishal, if somebody is starting out afresh, let's say a third year decides or a second year decides to focus on NEET SS preparation, and why I say so is because this time paper and even last time when it was conducted, the paper was such that even freshers coming out had a good chance of cracking NEET SS. So, what would be
Yes, sir.
your advice to them? How should they balance it out with their work? And what preparatory work should they do in second and third year so that the 3 4 months leading up to the exam becomes easier?
Yes, sir. Like we have seen in the last 2-3 NEET SS exams, the pattern has evolved such that there are more number of clinical based and image based questions which are being asked. So if any person is regularly into clinical practice like a postgraduates, they're constantly in touch with the subject and in touch with the patients and the radiology aspect of it. I think they have a good enough and equal chance, to be honest, of cracking the exam. It won't be very tough for them to actually get through, because I've seen some of my juniors have done really well in this exam, sir. So if somebody who is in, I understand first year is a bit hectic. We may not find time to study, but even during the first year, some basic concepts like the general surgery part of it, or the wound healing, and some basics of endocrine and hernia, appendix, what common surgeries that we do, if they are sure of the topics and if they study those topics in first year, that will be good enough. And in the second and third year, they should gradually start studying the standard textbook that we have, Sir Bailey and Saviston. So, including all the general surgery part plus the specialty part of it, they have to go through it line by line in the first two reads. And then once they're in third year, because they have less workload compared to the previous 2 years, they can focus on their surgical skills, obviously, and then in their free time, they can spend more time in solving MCQs, sir, which, because that is eventually what is required, that help us understand what our faults are and how we actually think when a particular question is being solved. So in the third year, they can spend more time in the later after third year. Once they're finished reading the textbooks, they can spend more time in solving the QBank test series and revising those topics which are difficult for them.
What about notes? Were you using pre-made notes or did you make your own notes? Because what I feel is that in the few months leading up to the exam, having concise notes somewhere is the most important tool because that helps you revise. Otherwise, you can't be opening up textbooks before an entrance
Yes,
exam.
yes, sir, right, sir. So I actually made my own notes, sir. One thing is it will help you to understand the subject better. It help you retain the knowledge better once you write down your points. So I focus mainly on doing my own notes from the standard textbooks, Bailey and Saviston, and few concepts from shorts also.
Hmm.
So, and in the end, when you're solving MCQs, if you find some extra points, you can add on to the notes. And in the end, it will become a very nice and crisp, handy tool for our revision, sir. We don't have to go through each and every line of the textbook again. So, just the notes should be enough in the end, sir.
So I think so. Yes, that is the biggest preparation which a postgraduate can do is in second and third year make their own notes, so that
Yes, sir.
you have those notes handy with you. And if those notes are handy, whether you've made them after watching the videos or as Dr. Vishal is saying with the textbooks or a combination of both, these would be extremely helpful for you to revise everything a month or two before the exam.
Yes, sir.
In terms of Q banks and tests which you appeared for in the Marrow app, do you felt that they were mimicking the INI SS and the NEET SS question patterns adequately?
Yes, sir. I think like even many of us have solved the free test series which were available.
Hmm.
The standard of QBank and the GT questions were very, very standard level, sir, because almost on par with the NEET SS level of questions. One thing is Maro makes us, help us to critically analyze the questions and think. It will help us to analyze what is going wrong, what may not be going wrong. The questions may seem simple, sir, but once we actually start analyzing it, it becomes a little tricky, sir, because the questions and the options are very close, sir. So I think that is how it will help you to fine tune the small misunderstanding what we must have gone through while studying, sir. So I think that is a very big differentiator of the Marrow QBank and test series, sir.
So, in the mock exams or the test series, what ranks were you getting before the exam?
I was consistent in the initial part of it. It was, I mean, on and off in the top 20, 30, sir. But in the later half of the phase, I was consistent in the top five.
Okay.
So
I
that
think so.
helps
It's
to
more
build my
like
confidence.
the national rank as well then.
Yes. So
Great.
actually, starting early with the GTs help me because it will help you one, to analyze your weaknesses, and then
Mhm.
it will also give you confidence that okay, right now this is your standing in the country, and this is how you want to progress, and you can set your targets, how to finish what subjects in what period of time, and then as and when the time progresses, once your rank keeps increasing, that will really boost up your confidence towards the end of the towards the exam phase.
Perfect. So, you took this was your second attempt. So, for 1 year, you were working in a surgical gastroenterology unit. And one
Yes.
question we get quite frequently is, how do you manage work and studies? So, what was your schedule like? If you could throw some light on that for the benefit of others.
Yes, sir. Because the NEET exam is such that more number of clinical-based questions are asked. So it is very important for the candidates to be in clinical touch is what I would advise, sir. Instead of
Mhm.
completely quitting work and focusing entirely on studies for whatever period of time,
Right.
it is important that we be in clinical touch, at least in the initial part of it. That is how I did. So I worked in the gastro department for almost a year, and around 1 to 2 months before the exam, I quit work and I focused on studies exclusively. So that is how clinical touch will help you actually understand what you've studied better. So it help you apply your practical knowledge, and it will really give you the sense of confidence that once you read something and once you see it in the words, that is very helpful to retain in the memory. Sir.
Perfect.
So that will
So,
also help you to
you are actually portraying that working along with studying for the exam is
studies.
a benefit when it comes to
Yes,
the
sir.
NEET SS exam.
Definitely, sir.
Perfect. Perfect. Right. So, thank you, Dr. Vishal. Thank you for taking out time and talking to us and sharing your journey. Before we end, any final words of advice to people who are entering surgery? There has been off late a lot of negative sentiment regarding surgery PG. Now that you've done your PG, you've cracked the SS exam. Just, what has been the journey like, and what would be your tips to people who are starting off in the surgical front?
Yes, sir. To be honest, my love for surgery started in MBBS final year when I started using Maro for PG entrance exam. That's when I watched some of your videos, and that's how I actually fell in love with Bailey. And then I started reading Bailey in the final year of MBBS. So
Great.
that's how I came into the field of surgery.
That's
Uh,
great.
I think, sir, one is the passion part of it, that you have a particular liking for the subjects once you develop it during your internship and you work in the all the departments. And some people uh, take up surgery because they have got a particular rank and they are not getting other fields, for example. So eventually, once we get into the field, there is no going back. We have to live through it for the entire life. So it is important that we remain calm and confident during the PG 3 years of post graduation. There will be definitely some hurdles, there will be some ups and downs, but I think that's a part of residency. And comparatively, I feel uh, the recent years of post graduation compared to, for example, how it was 10 years ago, I don't
Mhm.
think it's that difficult a task this time, sir. In the recent years, it
Right.
is slightly more easier. One is because probably the number of PGs are increased and workload might have uh, come a bit down, and many people are again focusing on NEET SS. So uh, we can actually do well in both. I mean, doing your PG level of work and what we have to learn practically during a post graduation, and simultaneously we can also keep studying for our SS exam if that is the target. So that preparation, like I said, from the second or third year, it is possible to manage both of them because I have seen people who have done equally well in both the PG exit exam plus the recent NEET SS exams. So
Yeah, no, I agree with you, and I also look. I tell everyone that the first 6 years are going to be challenging, right? Your PG
yes,
and 3 years post PG. in a surgical branch are challenging as compared to a medical branch. And
Yes.
if you've taken up this branch out of your love for it, then it's more likely that you're going to sail through these 6 years. But like you
Yes.
said, that it was if there was no other option and this was just a second choice, then things become really tricky.
Yes, sir.
Perfect. Thank you, Dr. Vishal. Thank you for talking to us, and we wish you all the best for your career in the future as well. And if you're in Delhi, I would love to meet you as well when you
Yes, sir.
join
Definitely, sir.
your
Thank you
college
so
here.
much, sir. Yes,
All
sir.
right.
Sure, sir.
Thank you.